I'm Alexis Furze. I'm a facial plastic surgeon as well as a nasal and sinus surgeon. In the office, we perform a number of procedures, one of which being the balloon sinuplasty procedure. This is a great procedure for the right patient and the patient that is a good candidate for it. Not every patient, though, is a good candidate for this procedure, but many patients are. The reason we do the balloon sinuplasty in a lot of cases is that we can avoid taking patients to the operating room and a lot of the downsides that are associated with bigger, more traditional sinus surgery. In the office, however, though, if the patient has too much obstruction in the nose, if they're actively infected, if they have active inflammation or active nose bleeding in the nose, it can make the procedure very difficult and maybe unsuccessful. So in certain cases, you have to analyze the patient to determine whether or not they are eligible and suitable for the procedure in the office. Recent case where a patient was using Afrin medication chronically, and by using this medication, the nose becomes desensitized to that medication, and it makes the procedure difficult, and we have to get all our patients off of Afrin well before the procedure. Otherwise, it can lead to problems during the surgery as well as complications after the procedure. For those of you who do suffer from sinus or nasal issues and believe that you may need to see a nasal and sinus specialist and or may need to have a procedure such as a balloon sinuplasty procedure or in the operating room sinus procedure, we are happy to answer any questions along those lines. Please leave a comment below and we will respond to you adequately and as quickly as we can.